All right, we are live on Amazon. If you are watching this show on any other platform, I encourage you to come on over to Amazon Live, amazon.com/live, and interact with us there. Uh, I'm D. Scott Smith, and I am happy today to have as a guest Harvey Castro. Not only is he a medical doctor, but he's an MBA. It reminds me of a friend of mine who is a CPA and an attorney, he said, because there wasn't enough jokes. But welcome, Harvey.
Thank you for having me.
We're gonna have fun. We've got you've got plenty of books, and we'll be able to talk about those. But the one that is front and center, it's in the carousel. I've got it highlighted right now, so anyone, if you're watching, you can click on that right now, and it will help you because ChatGPT is the thing right now. So, and good to see Dr. Alex Rosa and tuning in from Ohio. But Harvey, you were quick about getting a book put together for ChatGPT. So let's talk a little bit about the process. We'll talk a little bit about what AI is and why people should not be afraid of it, or what they should be aware of. And so let's get a little background on yourself, and
Yeah,
let's talk about this book.
I'm a ER board certified physician here in Dallas, Texas. I'm really focused on digital health. That's kind of where my passion is right now. That's what I do. And I'm currently working for Vital Health, and that's a telemedicine company. What's really interesting about ChatGPT and why I got to so interested, this has to go back to the first iPhone. When that came out, I was coding a patient, and while I was coding the patient, the nurse at the time took out a textbook and went through it, and it took forever. And I decided there's got to be a faster way, and so I came up with an app called IV Meds, and that was my first iPhone app. And since then, I did about 30 more. But then when ChatGPT came across, I thought, oh my gosh, this is the next iPhone. And I thought, I need to be out there telling doctors, telling patients how to use this technology. And
Mhm.
so, as crazy as it sounds, I literally just got to work. I actually used ChatGPT for the outline of the book. I said, ChatGPT, I'm writing a book about ChatGPT and healthcare. Give me a good outline. And it gave me an outline. And I said, okay, that's half the battle is just figuring out what to put down. And so
Mhm.
then my goal was, okay, I'm going to give myself a month to write this book. And then on January 5th, it came out, and I was so excited.
Nice. And I'm just going to put this up so people can see. There's the book right there. ChatGPT and Healthcare, Unlocking the Power of Patient Empowerment. That's one of the things that we really found about the internet, and things have changed, right? It was really one of those democratizations of information when we came to Web 2.0 all those many years ago, it seems like. It was all about user generated content, and now we're coming into Web 3, and AI is a big part of Web 3. So maybe you can just talk a little about what AI is and what it isn't.
That's a tough one. The way I'm seeing AI, obviously, there's different types of AI. The one that's really used currently, and there's about 164 algorithms in AI that were approved by the FDA in the last few years, and it's really in radiology. So basically, when a doctor's reading an X-ray, CAT scan, AI is looking at those scans and simultaneously finding subtleties and helping the doctor decide, hey, this could be
Mhm.
cancer, this could be not. I've seen this also in pathology, and so it's a common tool that we use. The thing is, nobody really heard of ChatGPT until they opened up the floodgates, basically, and let everybody use
Right.
it.
Yeah. Yeah. This is one of those interesting things. So IBM came out with their Watson computer, which famously played Jeopardy. And I forget whether it won or lost, doesn't matter. But one of the things that they did is they programmed it by using a lot of data, used huge amounts of data. So when we see signs, and we can fill in gaps if there's a tree in front of the sign, right? And so I know what healthcare is. So your head is covering part of that, but I see health, and then there's a part of
Right.
a C. My brain will fill that in.
Yes.
And what they did with Watson is they said, "Oh, here's the letter A. Here's how it's shaped," And then they showed it every variation of font, in context, and different stylized versions, 3D versions. And that's how then Watson was able to assimilate this information. And AI isn't really creating something, it really is just pulling from huge amounts of data, which I can imagine in radiology would be really helpful. So it's not just looking at a dozen different views, it's can be looking at millions of views and comparing them.
Yeah, it's amazing. I'm just astonished of how many things it can do, and I'm really studying the science behind AI, just how it's being leveraged, how it's being used in medicine. And interesting, there's not many companies out there looking at this space. And ever since ChatGPT came out, now I really think once the API comes out, there's going to be millions of
Mhm.
applications out there worldwide.
Yeah. Yeah, it's really interesting. I was using a different AI program, I don't know, probably a year ago that a friend of mine recommended. Disappointing, I think, is the best way that I can say my experience with it was. And when ChatGPT came along, it was not disappointing.
Mm.
I was really interested in how it was working.
Yeah. I think a lot of people don't recognize that they are using it. For example, if you have your iPhone or if you have Siri
Mhm,
or if you have your Alexa, there's that integration that's going on in the background, and it's looking to see what you're doing, using, and how to make your day more efficient. And without you realizing, it's selecting the right songs. My wife and I joke all the time. I love listening to Spanish music, and
mhm.
she loves country music. And as soon as I walk into the kitchen and talk to her, the radio switches to Spanish, and she's like, "Oh my gosh, it hears your voice, and it's switching over to the different songs." And I
Mhm.
find it interesting how that's going on, but we don't really realize.
Yeah. If anyone and people might be concerned, "Oh, I don't wanna use AI, it's like cheating," but realistically, we're using it every day, just like you mentioned there with that example. But if anyone does a search, they go into one of the major search engines, they put in some fragments of words or whole words, or they misspell them.
Yeah,
The AI is actually going, "Yeah, what you're really looking for is this," right? So if I said
that's
chat
crazy.
ABC, it might say, "Do you mean," it'll just pull up GPT.
Yeah, and it's funny you mentioned that. I use that example a lot. When you can go into Google and you type something up that you're looking for, the
Mhm,
winner really is whoever sponsored at the top, and then whoever spent the money on the SEO words to make sure
mhm.
that it lines up. So in reality, you may not be getting what you're looking for, or at least it's whatever the company with the biggest dollars wants to show you. And this is kind of where I'm biased, where I'm going to bring in Bing ChatGPT, or I think they call it Bing Copilot, and
Mhm.
they're taking the words that you're using and literally looking for these things. And so they're combining the internet plus ChatGPT. So I think that's going to be the winner in the future. And I
Mhm.
see why Google just called a code red and why their stock dropped over 10% in one day.
So tell me about what you know about the brains behind ChatGPT. Have you done some research into who it is that's created this?
Yeah, so it's a really interesting story because when it was created, the company is called OpenAI, and as the name sounds, like it'd be open to everyone.
Mhm,
And what was really interesting is you have Elon Musk and other millionaires or billionaires that donated their money to the cause. And their
mhm.
whole goal was to not let any corporation have this technology. Fast forward, a company called Microsoft comes in and spends billions of dollars and now owns 49% of this technology. And so
Okay.
what's so ironic is this was supposed to be just for all of us to use and be open, and never
Mhm.
to have a corporate spin on it. And we can go into the ethics and so many issues that once a corporation has this kind of technology, it becomes really dicey for people.
Mhm. Yeah, well, it's an interesting deal because we can go back to the space program, and there was a lot of money that was invested. It was tax dollars, but we're all benefiting from that today in
Mm.
so many ways. A lot of the technology that we have came out of the research from the space program, and it seems like this type of thing is still going to benefit us, even if Microsoft owns 49%. There's
Mhm.
still going to be spin-off technologies from this.
Oh yeah. Yeah, it's fascinating. I didn't realize how much I use Grammarly, and
Mm,
I
mhm,
was able to integrate it into my iPhone. And now when I send text, I verify, or if I post something on LinkedIn, I verify it with my Grammarly, and it's just something that's become a daily thing.
mhm.
The more red marks I on it, I see how bad I'm writing. So,
Well, and yes, exactly. We all use AI in that way, right? When you're writing a Word document and you get the little red squiggle, hey, you're going to pay attention. Maybe I used the wrong there in that
exactly.
spot. So it is around us. We use it. We may not know that we're using it. But I think being intentional about how we use it is probably the right way to go to
Yeah.
be an informed consumer.
And to your point, that's why I wrote the first book. This
Mhm,
book behind me on my, let's say this is all backwards. This is my second book, and then this one's
mhm,
my first book. The first book, the goal was just to get the word out.
mm, mhm,
Kind of big picture AI. How does that work? What does it look like? I call them our geeky friends that are out there that know everything that goes on. They saw the first book and I'm like, I got this. But the
mhm,
second book was really intended just for physician. I'm sorry, just for patients to show them how to go through it. And then that brings me to the next point. There's a lot of dangers if you don't know how to use it. And let me explain. For
mhm,
example, I'm an ER board certified doctor. I could look at something in the medical literature that's related to emergency room, and I know it's correct. But I'm not a pediatric cardiologist, and I always like using that example. If I look at some procedure from a pediatric cardiologist, to me, from the medicine, it may look good to me, and I may give it my blessings and say, "Yeah, that's correct." But if I show it to a pediatric cardiologist, they may look at it and say, "Oh my gosh, Harvey, no, this is half right, half wrong. Like you got it all wrong." And that analogy I like to use because, ironically, we're on ChatGPT because we're asking a question. But if
mhm.
the output we're not an expert in that field, we may look at it and say, "Yeah, that looks good to me. Let's go." And in reality, it's half right or half wrong. The latest thing I read recently, if you go into ChatGPT and you say which one's heavier, a pound of feather, a pound of lead, it will actually argue with you and tell you why one weighs more than the other. And the logic is there, and they'll argue. The ChatGPT will keep going, and so
Mhm.
that just shows you that it's still in beta. It's not quite there, but with that said, I still
Mhm.
think it's got space in healthcare. I still think
Yeah.
we can still use that beta today. Now, where will it be in a year or 2 years? It's gonna be in another place, and I think there'll be even more applications.
And the most of us that are going to be watching this and reading your book are not going to be physicians. We're on the patient side of that
Yeah,
equation. So what are some good things we should do and what are some decisions that we could do? Because I know I have friends that have scared themselves silly Googling up symptoms,
yes.
the WebMD syndrome.
Yes. I was in med school when that was a thing, and I remember patients coming in and coming up with diagnosis, and I think
Mhm,
we're gonna be there again. I think patients are gonna do that. I worry more with excuse me, with patients that are in third world countries that could possibly get medications. Here in the United
mhm,
States, the physicians will have to go through and verify things and then be able to write it. But in third world countries, they may be able to self-diagnose, and even worse might be the case that they go to the pharmacy, get drugs that are not indicated because they don't even have the disease or they are allergic. What kind of things to look out for is this thing that they call hallucination effect. And then I kind of mentioned it earlier. It's just this whole phenomena that the chat GPT may give you an output that you don't really understand. And you may think, oh, yeah, I'll go with it. But applications that we can use today, I'm a big believer in education. And
mhm,
so I believe strongly that just like you're going to Google, I was diagnosed with high cholesterol. What do you think? To do those things. What I'm encouraging people to do is to create this more as a partnership with your physician. And
mhm,
so
mhm,
any information that you get, especially medicine, I have an algorithm in my book that goes through how you should use it. But basically the skinny is if the output comes out from ChatGPT and it's gonna something that's gonna affect you, you need to verify it with a professional to make sure that that is the case. With that
mhm,
said, I've been playing around with it, and I'll give you a quick example. One of the things I talk about is if you're a diabetic and I need to eat a clean diet and low in
mhm,
glucose or carbohydrates, it'll walk you through. But what's really fun, you can like, oh, I could do that on Google. But what's special is you can tell ChatGPT, hey, I'm allergic to eggs, I'm allergic to fruit. Don't put that in my diet, and it'll give it to you. and then you can ask it, give me some recipes, make me a grocery list, and you can say, hey, I'm going to New York City this week. I need the diet for which restaurants to go to, and it will tell you which restaurants. So
Mhm.
it's really crazy how much more you can get out of it.
Yeah, so there's some practical things that people can do, not just playing around,
Yeah.
but I like this idea of partnering up with physicians. And so let's jump back to the other side of the equation. Uh, I I was just thinking about where this might take us in the future. So when we moved to Oregon in 1965, our family physician, made house calls, but that model, of course, was not sustainable. So then we moved to going to visit our doctor at the office. So he had a physical building, little waiting room, reception, one nurse on staff, and the doctor. And that model became non sustainable. So now we went to the local regional medical center where they've got lots of staff, and the physician is really just accountable to himself or herself. Uh, I'm just wondering how telehealth and ChatGPT might allow me to not just get medicine, but get specific medicine. So maybe an expert in, as you mentioned, cholesterol for my demographic. It, let's talk about some of the future and how this can make things great.
Yeah. Well, for one, it's really sad. There are many physicians that are burnt out, they're retiring early. So there's a huge strain on our healthcare system.
Hmm.
There's unfortunately, the patients have to wait a long time to see physicians. Sometimes specialists may take up to a month to just see your cardiologist. And so, with this technology, I think it's going to help in the future. Kind of triage to some extent and say, okay, I'm having X disease. Here are the symptoms, and then uh, telemedicine pops up, and then you can talk to your doctor and verify these facts. And I
Hmm.
think it's going to help with physician burnout, but then more importantly, I think it's going to help patients have access quicker to technology or to healthcare rather. And I think those things are going to be important for all of us because I truly believe that the more information we know, the better our health will become, and then the more we'll start focusing on preventative medicine. And now, instead
Hmm.
of worrying about being a pre-diabetic, maybe we just avoid pre-diabetes altogether. And so it's going to be fascinating how much medicine's going to evolve because I think all of us are just going to become smarter when it becomes our health.
Hmm. And you mentioned education. And how do you think ChatGPT will help educate physicians?
Oh my gosh, it's crazy. Every 72 to 74 days, medical knowledge doubles. And so if you think about that statement, that's just crazy. I
Yes.
mean, the amount of information that we have to know. And that's why all of us go into our own specialty because there's no way
Hmm.
you can know everything. With that said, I have seen medical students already using it, and let me show you how. They're putting in maybe the first couple of pages to say physiology or heart anatomy, and it'll spit out summaries, or it'll give you. You can ask it for flashcards. Um, More advanced medical students, I'm seeing them use it as putting them as clinical vignettes, and so we get these little cases, and we can put it in there, and then ChatGPT can kind of help you diagnose and say, okay, it's possibly these following things. And so, as a medical student, that's huge because instead of calling your professor at 2 in the morning or calling a colleague, you can start conversing and learning from it. And so, it's just amazing. I'm just
Yeah.
blown away on how medical students are using it already. And then
Hmm.
to take it to the next level, I have physician friends that are telling me, "Oh yeah, if I'm stumped on a case, I'm putting the symptoms in ChatGPT just to see what it says, just to see if it gives me something that I hadn't thought of." It's
Hmm.
more with the rare diseases, things that maybe there's 20 cases in the whole world that maybe we've heard of it back in med school, but we never seen it. And so we're maybe a little rusty on those things. Just because we're not seeing it doesn't mean it doesn't
Hmm.
exist. It's just that we're missing it. And so I think this will become more of an aid. I know we keep talking about ChatGPT. I think in the future there's this GPT that's called BioGPT, and I think
Hmm.
that's the one that's going to be very focused on healthcare. And I think that in the future will be the ones physicians use.
That's what I imagine was is that this would become a more specific set of AI around physicians or for
Mhm.
physicians. Way back, and not to be too political, but way back when it was candidates McCain and candidates Obama, candidate Obama. I actually wrote to both campaigns about health, and I chose healthcare to help differentiate between the two. Wasn't such a hot button issue at the time, but essentially, I said in nicer terms than this, I don't think either of you even understand high school level economics, because your healthcare plans really are focused on the payment side. It's really insurance reform, not healthcare reform. And neither one, and all you're going to do is make it easier to pay, which means the cost is going to go up, as opposed to who says they're going to create more healthcare workers, more physicians, more MDs, more physicians assistants, more registered nurses, more all of these folks, right? And this is where I'm wondering where AI like this might help us to create more medical personnel to help alleviate some of the burnout.
Yeah, I think just you know, t- I remember when the I was using my mobile device, patients were like, "Why are you on your phone?" And I'm like, "I'm actually not on my phone. I'm using it to refer, to this document or this
Mhm,
database." I foresee that being just integrated into what we call the electronic medical record in the future.
mhm,
I've already seen some prototypes that are amazing. That basically, as you and I are talking, there's two AIs going. One is just recording our conversation and documenting everything. That way I don't have to be looking down at the computer and typing. I can actually have a conversation. So that's amazing. The second part, it's already compiling the symptoms and then giving me graphs. Not you can't see, but I can see on my side saying, okay, he said chest pain 4 times. He said weakness 6 times. And then it kind of gives me like a bubble graph to say, okay, here are all the things. Okay, yeah, let
mhm,
me focus on this. And so I see this technology being even better for all of us in that it's going to help lower burnout. And then from a legal point of view, hopefully doctors are missing less things, and to the point where I think in the future this will be the standard of care, which is going to be crazy. But I think that it's going
yeah.
to be expected that you use
That
a technology
you're
like this.
you're absolutely right. And it's adoption. It's as we start to adopt technologies, and I always use airline flight as a great example, because there was a time when planes didn't exist in passenger airlines. Then one day, here's the DC-3, and people are piling onto it, and we became used to that. But it was a propeller driven plane. Then when they got rid of propellers and started using jets, people were like, I don't want to get on that plane. Where's the
Yeah,
propeller?
yeah.
Now people get onto they go from their jet to a commuter plane with a turboprop, and they see those blades spinning out there, and they're terrified. So
Yeah, it's
what we
funny.
hate now,
It's
we
funny.
loved before.
Yeah, and to your point, I had created multiple iPhone apps, and Apple rejected pretty much half of them because they were like, "No, this is not allowed." And I look now at the apps that I was trying to push back, when the first iPhone came in, and it's a joke. They would have all passed today, because everybody was scared. And I feel like we're in the same. People are scared they're going to lose their job to ChatGPT, and is a robot
Mhm,
going to take care of me? I don't quite see that. At least not
mhm,
now. I think. What I keep telling people is it's going to be about efficiency. Maybe a doctor may be replaced by ChatGPT, but it's not because of ChatGPT. It's because another doctor is using it and becoming more efficient. And the hospital system's looking at that doctor saying, okay, these are the doctors we want to use for this.
mhm.
So,
Well, I know that in many cases, not just in medicine, but there's a need for urgency. And so if you can make a diagnosis quickly and get the right treatment, or not no treatment, if that's what it warrants, that results in a better healthcare outcome.
yeah,
And I don't see anything here that says this is going to cause things to be slower.
yeah, agree. Yeah, it's amazing how fast things are being adopted, and 100 million users are quoted as using ChatGPT, and that sounds like a big number. But if you look at the whole world population, that's
Mhm.
under 1% that are actually using it. And I know that even itself sounds large, but in reality, it isn't.
Yeah, well, it's funny because when you move in circles of technology adopters, there's very few people that I talk to in meetings that aren't at least aware of it or have tried using an AI, or specifically ChatGPT. But I did have a conversation this last week, uh, and here's a guy that focuses on distance education. That was
Mhm.
what his PhD was in, and he's just like, yeah, I haven't used it, and
Yeah.
I
Well,
was
the
surprised.
educational system, and I understand why I don't wanna say scared of it, but they're hesitant. I think it's just a retooling. Instead of having students write papers, I think we just ask them the same question. They can use ChatGPT, but then we test them in class, and we have almost a dissertation or a discussion
Mhm,
about it and see what they
mhm,
learned. I think that's the real truth, because anyone can write a paper, but what can you learn out of it? And so I think it's just using these tools to another level, and it's just the way we're thinking. I think we just have to retool a lot of different industries, and I know people are freaking out left and right, but I think it's just a matter of just
yeah.
retooling and relooking at things.
And the nature of you being a physician, you get to talk with other physicians. What's the word about AI, amongst your peers?
It's the bell curve. You have those
Mhm,
early adapters that are like, "Yes, let's do it," and you have others that are like, "Ah, I wanna wait and see," and then you have some others that are like, "Oh, I'll never use it." But I think it's just a matter of time, and that's why I wrote the book. I wanted to get people to understand the subject, understand
mhm,
what's going on, and be able to use it. I'm a big believer that if physician or healthcare leaders are the ones driving this technology, the output will be more patient centered and better for the patient. If it's big corporations driving it, then it's going to have a corporation feel, and it's probably not going to have that patient focus patient focus. So I'm a big believer, and let's get this subject out there. Let's talk about it, and let's work together towards creating better
mhm.
products for our patients.
Yeah. Well, and I think it's definitely the right time for folks to get involved early, and understand it while it's in its simplified form, while it's in beta, while it hasn't become mainstream, so that when it does become mainstream, you know what's going on in the background.
Yeah,
I
agreed.
just think that's a great and so both of your books. So we got both of them here in the carousel. Let's talk about some of the other books that you've written because this wasn't your first journey into the bookstore as an author.
No, my first book, honestly, I wrote one that was about neurology when I was in med
Hmm.
school, and this just shows how, we're our toughest critics. I wrote it back in med school, and I literally got it on the App Store, but then I put the price so high that I knew no one would ever buy it because I just didn't want to be critiqued. And then I literally wrote the second book, which is called Success Reinvention. And then I started thinking about it and what I was basically preaching in a book. And I said, okay, I need to rethink this. And I reformatted, I updated the neurology book and then put that on the App Store. But the Success Reinvention book is probably my favorite and one that comes dear to my heart just because it's about basically how to become successful. But I write my journey from rags to success. And I basically come from a really humble beginning on government support, basically food stamps, and at some meals I didn't even know if I was going to have dinner that night. And
Hmm.
so I went from that to becoming a doctor and going back to get my MBA and creating all these different companies. And that book to me was the one that I wanted to just kind of give back to those other kids out there that were like me growing up with
Hmm.
nothing. And that's why I wrote that book.
I love it. So every time there's some uh, breakthrough like this. The internet, right? When it first became available, when we were before that, we were using internet relay chat. You probably don't
Mhm.
remember that. Maybe you do. I don't know. But there has been a lot of things over the years. Telnet was another one of those ways to connect. But it created opportunities for people to build a business from scratch on their own. And obviously, you've been able to take this information, create your first iPhone app.
Mhm.
Now you've got books that are out. What do you see AI in general create? What kind of opportunities do you think that will create for people?
I think it's gonna change. I honestly think we're all gonna have our own assistant. We don't realize it, but I think just like we use Siri and Alexa, it'll just be common. So as we're writing emails and replying to emails, or as we're texting, there'll just be a auto
Mhm,
generator. And I know it's gonna sound funny because I think my GPT will talk to your GPT, and we'll have conversations that way. And it sounds crazy, but I honestly think that's what's gonna happen. But I think from an efficiency point of view, it's going to be nice to have that AI. And I know people are cringing out there saying, "No, I don't want that." But how nice to have the mundane things of life just kind of create it for you. For example, if it'd be nice to have a dinner menu, all your meals kind of prepared in the sense that it gives you a grocery list, your what you eat, what you should be eating, and then you just review it, and then you go to the grocery store and it's already pre-selected and it's already waiting for you to, and it's already being delivered. So those kind of
Mhm,
things we kind of take for granted, stuff that I hate going to the grocery store, but having the AI tell me what I should and shouldn't eat to make my health
mhm,
better, or to lose more weight, or to if I'm trying to build muscle, increase my protein intake or
mhm.
whatnot. I think that would be nice. And so I think those kind of examples is what's going to become common in the future. We joke about it today, but I think in the future when we watch this video, we'll be like, oh yeah, yeah, now that's common.
Harvey, one of the things I think about you. So you mentioned going to the supermarket, and there was a time when supermarkets were controversial, right?
Mm,
That they were going to destroy the mom and pop businesses
yeah.
because instead of it used to be, you would go to multiple stores to fill your cart. Go to the baker, go to the butcher, go to these different departments, go to get the vegetables here and so forth. Um, and then they all became in one place. Now I can go to one store, park once,
Yeah.
drag my cart around the aisle and fill it up. And it didn't destroy all the mom and pop businesses because there's more convenience stores than there ever were
Mm,
mom and pop stores. And most of those are owned by mom and pop.
yeah. Yeah, it's interesting. I think we'll just be more efficient in our jobs and in our daily life, and it'll give us more time to refocus on things that matter.
Mhm.
Spend time with those loved ones, with your kids, with your spouses, with things that matter. And I think if think of how much time we waste on just doing mundane things. If we didn't have to do that, and that just opened up more time, then that gives us more time to do the things we need to be doing, which is taking care of ourselves, getting enough sleep, making sure you're exercising, make sure you're going on walks, and
Mhm.
obviously making time for family.
Well, it's really interesting because you mentioned that you use ChatGPT to create an outline, or at least give you an idea for the outline.
Yeah.
But the interesting thing is that ChatGPT did not create the outline. I mean, that is to say, you didn't walk into your office, turn on your computer, and it says, "Harvey Castro, here's what you're going to do today. You're going to write this book, and here's the outline for it." You had to have your creative input to make that happen to begin with.
No, and I'm glad you said that because I sometimes downplay a lot of things. But you're right. The output of ChatGPT is only as good as the input. And as
Mhm,
a physician, the things that I can ask and take it down a certain path is my creativity and the way my brain works. And I'm using it as an assistant to help me add to it. Sometimes I'll have some brainstorming sessions and I'll say, okay, here's this, but then if I don't like the output, I'm like, oh, that's not good. Let me
mhm.
take it down a different path, and that's all available. But I'm glad you said that because you're right. Sometimes I downplay it, but in reality, it's true. It's only as good as the input that's going into it.
And you had to create it. And so when you talk about relieving us from some of the mundane things, but it actually opens up a lot of creative opportunity.
Mhm.
So there might be that person. So we said, "Oh, we're afraid that this is going to write all my children's essays for their high school, and they won't learn anything." But on the other hand, I don't believe that that's true. But there might be people who say, I would love to write a book about my family history. My grandparents had a really interesting life, but I'm bad at spelling. I'm bad at grammar. I hunt and peck on the keyboard. I can't type very fast. Um, my hand cramps up trying to write. And then what am I going to do with it anyway? And so there's a lot of barriers. But now what I've seen with Chat GPT and the other AI programs is, is I can say, uh, tell a story about, or write this story, and then I just throw fragments in of my grandfather. He was born in Mexico. He came to the United States during the revolution. He was a migrant worker. He ended up working at Disneyland, and that's where he retired. And it'll actually put it into sentences and
Mhm.
paragraphs with good grammar
Yeah.
that I can now share with my kids.
Yeah, it's amazing. I'm blown away. I that's what I sort of do as well. And then I take it to another level. I do that, but then I put it in Word, and then I put it into Grammarly to make sure that it's going through.
Mhm.
Because sometimes some of the things it says may not flow as well. I'm not the best person at writing, but I use technology to help me. So, I think personally, Google has made me a worse speller because now I just kind of half spell things and just let it autocorrect, and I'm all right. There we go.
Yeah, my son brought his when he was in high school, he brought a paper to me to see, and he had misspelled a word, and it was, highlighted by the teacher saying, "You misspelled this word." Handwritten paper. He looked at me and he said, "Oh, must have been a typo."
That's funny. I
Uh,
joke about, my Tesla. At one point, I had a Tesla, and I say it actually made me a worse driver because I was getting so dependent
mhm.
on certain features of the Tesla that later when I had a gas car, I was like, "Okay, this I'm not the best driver here." But it's keep in mind, that these things are there for us to use,
Mhm.
and again, it's like the bell curve. Some things you should do, and some things maybe you shouldn't because the technology is not quite there yet.
Sure, yeah. But again, I think as you said, in measure, we're able to relieve ourselves of some things or allow us to express ourselves in a way.
Mhm.
Um, and we use, as I said, we use AI all the time
Yeah.
and every day.
Yeah. No, it's so true.
So, yeah. So, what do you think is the big breakthrough in medicine as far as AI in the next 3 years or so? That I mean, because you're talking about doubling every 72 days, right?
Yeah.
The knowledge base. I mean, that's an unbelievable, pace. It makes me wanna not get diagnosed for, like, 73 days from now because it'll be better, be twice as good.
Yeah, it's true. Yeah, see, that's a tough one. I foresee the future in my angle. I see it as a merge of all the technologies. We hear about wearables, and we hear about ChatGPT, and we hear about AI. I think in the future it's just going to be a combination of all of them. For example, this is kind of pie in the sky thought. I think, God forbid, you having symptoms. You wake up in 2 in the morning. You'll type in. You maybe just voice your symptoms. A
Mhm.
doctor will pop up. It will already have a differential diagnosis for the doctor because it's all the things you said. It'll say, "Oh yeah, you need to come to the doctor." A Tesla equivalent will come pick you up, and it will drive you to the hospital. The doctor already know all your information. You don't have to register. You could walk in. They see you. Let's just pretend all the blood work, everything's fine. They send you home on medicine. You get home, you really want to know more information about this, so equivalent ChatGPT will explain, or if you have more questions, and then obviously a doctor will be blessing it. But then you use the restroom in the morning, that data is analyzed and sent to the doctor. The doctor changes your medicine, but then it prints at your own house, and then the medication's printing. All those
Mhm.
things that I mentioned actually already exist. It's just
Sure.
a matter of taking it to the next level. And I
Mhm.
know that sounds crazy, but I mean, we're already printing our medicines. We're already using AI, and so I think in the future it's just
Yeah.
going to be a combination of all those things into one.
I love it. I was just thinking too that every time I go visit my doctor and I get back and we have online medical records, so I can go and I can look at the blood test and it'll tell me some information. But I could see where Chat GPT or AI, we'll just say a medical AI could take those results and the information that the doctor had uh, from the exam, emerge those into something that's not as generic, but it's more specific for me.
Mhm.
Like, this is how you're trending. Your cholesterol is trending up, trending down. And I can see it as being an aid to the patient and certainly to the physician to not have to go in and say the same thing over again, but let it be adapted to me.
Yeah, I have to share this quick story. I spoke to a hospital in Europe that is basically using all of these features in the following way. They gave an example of a pediatric child leaving with asthma, 5-year old, and basically they took what currently is the protocol for discharge papers for the 5-year old, and they converted it into a story using ChatGPT. Put it at a fifth grade level because
Mhm.
ChatGPT can say, give me this information at a fifth grade level," and it did it. And then they use like a Dolly equivalent to create the images that would go with this and made a coloring book. And so that now when they discharge anyone with asthma, they give them the child, they give them this coloring book, and they can go through and analyze and draw pictures and really take in that information. And I was just blown away. I'm like, that
Hmm.
is the future of medicine. I mean, can you imagine how well, instead of giving a cookie cutter asthma that's, discharged, that could be for a 30-year-old or a 2-year-old, it's the same
Hmm.
thing. They're really customizing it for that patient.
Yeah.
I thought this is amazing.
It's funny because I was talking with a friend and he was saying something about children today not knowing what it's like to grow up without a phone. And I
Oh
said,
yeah.
yeah, they don't even know how to grow up. They don't even know about phones with buttons, right?
It's
I mean,
true.
that's just, it's but it's advanced very fast. I like the way it's going. I personally, I think it's going in the right way because we're getting more information to the people who need it quicker in a form that's more consumable. Just like you mentioned that book. So yeah, a generic coloring book, yeah, but one that's personalized. The child's going to take more interest in that.
Mhm.
Uh, we're also going to there, but just as I said, that child won't know what a phone is with buttons. They're also not going to know what non-personalized material is going to be.
Yeah, it's true.
What about let's as we kind of start to move to winding down here, I want to ask you some questions about the integration of wearable technology because obviously, like the Apple Watch and some of the other smart devices that are out there, are able to monitor things like
Mm,
so certain vitals. I
mhm.
think like
Oh, yeah.
a pulse rate and
Yes.
temperature and things. I think I saw one that had blood pressure. I don't
Mhm.
believe it,
Yeah,
but maybe.
yeah.
So how does this all work with AI?
Yeah, it's amazing. Basically, what I'm seeing is, for example, there's continuous glucose monitors. Those are right now indicated for diabetics, but I've seen off-label use for non-diabetics using it. Actually, I'm working on a book about this technology,
Of
but
course you are.
uh, that's hopefully coming out in March. But basically, this technology and how it integrates with AI is using that data, and so now it can predict that that person's sugar is going to go up based on what they're eating, and so it's
Mm,
combining the real nutrition of what you're typing in with this continuous monitor of what your sugar is. And then the AI is analyzing that food and able to predict, okay, this is how it did with this type of food. This is how it will do with this. Because you and I are totally different. Just because
mhm,
you have a banana and I have a banana, the sugar may be totally different for both of us. And so the way AI is working with this technology is helping you predict so that when you're able to eat the next meal, it'll help start creating menus to say, okay, these are the things you need to eat, more
mhm.
specific to you. So the future is just unreal for me. I'm excited. I feel better when I'm an elder and and up there in age because I really think the healthcare that I'm going to have is going to be much better.
Mhm. Yeah. I have a friend that's well, in fact, Russ was going through a cancer treatment
Yeah.
for melanoma, and he met a gentleman that has had the same diagnosis, similar uh, surgery path, but like 10 or 20 years earlier. And you mentioned this 72, this doubling in technology, and Russ definitely benefited from modern medicine as opposed to medicine that was 10 years old.
Hmm. Yeah, that's the hard part for me. My mom had cancer and she's fine now. But the technology, if she wasn't where she was, she happened to be in front of the number one cancer center in the United
Mm,
States, and that helped. But God forbid our parents are from Colombia. God forbid she was still in Colombia. I don't know if she would have had the same outcome. And
mhm,
so it's so important to keep up to date and to go to these specialized care. Not to derail the conversation too much, but I this morning I did see it was kind of like a virtual reality where surgeons from all over the world were gathering and they were going over surgery together and they were actually
mhm,
having surgery with the patient, but then these leaders in these types of surgeries were all together and using VR and using technology to kind of coach each other how to make this technique even better. And I
Mhm.
thought, oh my gosh, the level of medicine is just going to keep getting better and better.
Yeah, and we talk about things like printing medicine and
Mm.
all the wearable tech, and obviously there are just like there's food deserts, there are medical deserts, and it's not just in developing countries.
Yeah.
It's everywhere, and so I can imagine that by having this available, the local medical staff will be able to tap into the best medical brains available.
Hmm. Yeah, for sure.
Yeah. Well, you mentioned you got another book coming out, maybe in March. You've written several other books. Then we mentioned some of those. One of those neurology for the non-neurologist was the first one. That was your first book.
Yeah, that was the geeky self back in med school.
Well, I love it. The brain just fascinates me, and I'm glad that there are scientists that study it because, oh my gosh.
Yeah, agreed. Agreed.
So, if people want to get in contact with you, Harvey, what is the best way to do that?
Yeah, I'm on all the major social media platforms, so LinkedIn, Instagram, Facebook, Twitter,
Mhm.
um, and I actually just started TikTok. And
Okay.
my handle is the same. It's Harvey Castro, MD as in medical doctor, and I'm posting on all of them. And anytime I do any podcasts myself, I'm trying to stream them on all those platforms as well.
Mhm. All right. Well, that's great. This has been a fascinating conversation. I appreciate you taking the time. I know that, as you mentioned, physicians don't have a lot of extra time, but you spent time here with us, Shell, and so I just look forward to this and what comes out.
Well, I appreciate you having me, and I'm excited. And hopefully, if I could be of any help, just reach out.
All right. Well, we'll put this up and we'll wind up here in a moment. Stay in the green room. We'll be right there. All right. So it has been a blast just talking with Dr. Harvey Castro. He's an MD and an MBA. There's his most recent book, Chat GPT and Healthcare, Unlocking the Power of Patient Empowerment. I will say one of the best ways to get a hold of him is to get the book and give it to a friend. Send it to, this is a great thing about Amazon. You can send it to a friend. Just buy it, add it to cart. Be the hero in somebody's life. With that, we're going to sign out. Thank you all for joining us. Have a fabulous day. Cheers.